appreciate those insightful comments and Dr. Elders. And at this time, I'm going to ask the members of the committee, starting with Representative Tillis, if you have any questions for Dr. Elders, and then I'll move into
Well, first, thank you for coming today. I have a couple of questions, but I'll also yield to Representative Avila. Can you speak to any data around the potential addictive effects, the compare and contrast between opioids and cannabinoids? Any research that exists there?
Well, the research that...
Maybe use the mic. Just
Oh, I'm sorry. The research that I'm aware of and that I know about is that, you know, we used to think that marijuana was not addictive, but now our feeling is that compared to the opioids, there's just a 100-fold difference. The opioids are far more addictive than the cannabis, and it's much easier to get off and quit if you want to, and it's usually will take a much longer period of time.
One follow-up on Karen, and I'll yield to Marilyn. I read, and it may have just been anecdotal, but I read once, I have a couple of friends who had chronic pain, one back pain, and one, I guess, I can't really remember the source of the other one, but I'm a couple more attuned to any articles and things around chronic and persistent pain. Is it true that there's a higher rate of suicides among people who have chronic pain and who are not able to find adequate treatment?
You know, I can't, I would say yes off the top of my head, but if you know, to be able to give you and quote you the study, I don't have that. But I definitely would feel that there would be more pain. I've had back surgery too, so that was, you know, and that was severe neuropathic pain. And I was on an airplane when I flew from Chicago, and if they hadn't had those windows sealed, there's no question I would have jumped out of that airplane. You know, it was just that. Well, no, it's just the pain is that severe. And patients with multiple sclerosis have the same kind of problem. Patients that have late diabetes, you know, complain of the neuropathic pain that they have. So it's severe.
And Mr. Chair, I was wondering if Lady would like to speak on the same question.
I'll just endorse exactly what Dr. Elders said. I don't think there's clear data that there's increase in suicide rates, but there is very clear data that people with chronic pain have higher rates of depression. And depression, of course, is the strongest risk factor for suicidality, but depression is a profoundly disabling condition in and of itself.
I'll yield to Representative Avila if she has any questions.
Yeah, and I don't know where to start. I guess my first concern is when you discuss the CB1 and the CB2 receptors, they bother me because the CB1 receptors are in the brain, and it's proven that you have memory impairment. And my question is, with people who are prone to Alzheimer's, are we studying anything there? CB2, these are receptors that are found in the spleen, the lymph nodes, and you're talking about the immune system, and you already have people on medication that's suppressing their immune system, and you're adding an additional factor to that. I can't see where you're really helping the situation.
Well, when you're talking, I'm not sure. I won't say we don't know, but I don't know enough about Alzheimer's to just say what's going on. You know, we have a lot of things that may impair memory. You know, we have alcohol. That kind of wipes us out. And we have a lot of other drugs out there. I don't know that we have any. We know that there may be some memory deficit, but I don't know whether it's not. As far as we know, it's not a permanent thing. But I don't know. We don't know all the things that cause us to get Alzheimer's. We know a lot of things about it, but we don't know the cause.
Oh, yes. I guess that leads very well into not so much a question as a concern of mine. I go back to a 2003 article that was in the British Medical Journal, and they had two large studies, and the studies, of course, showed that, as you were saying, there was a 15-year study and a 10-year study on mortality. and there wasn't a link developed there. However, there was a very strong caveat in this article to the fact that we don't know about marijuana. We have not done logical, scientific, evidence-based studies on the long-term effects of marijuana. You're talking about a product that has 50 to 70% more carcinogenic compounds than tobacco, and you mentioned tobacco around this place, and we go nuts. So I am very much in favor of study, but not at the North Carolina level. I'm in favor of study at the medical level before it comes to us to make a decision if we should allow our citizens to use this stuff.
Well, you know, I'm aware that I'm in North Carolina, and I'm aware about the cigarettes, but I also know that you are aware that cigarettes kill more people in the United States every year than anything else we've got. But I'm not here. This is out of the health director, so you have to know. Now the Surgeon General, so you have to know how I think about cigarettes. But that's not, you know, I think the thing that we're really here to discuss today. What we really see back in the days when we started cigarettes, we probably wouldn't have ever started smoking cigarettes had we had as much science behind them to know. But, and have we known all the things that we know? Well, I feel we need to study, and that's to me what I thought this was about, that we need to do this study on marijuana and to really have it scientifically done and be able to get be able to get marijuana that you know the quantity, you know how much you're being given. Because right now, it's almost impossible to do the studies. If you want to talk about doing scientific studies, you have to go buy marijuana off the street. You know, our government for a while was having Mississippi grow the marijuana, and I think sent it here to the research triangle to be processed and all, and made the cigarettes to be dispensed out to the people. You know, but I think that they really stopped doing that now. And so I really think that this is something, but you know, they have everything set up to do that. But I think this is something that we really need to get the hard facts on, and we really need to look at it, right? You know, but that's general, that's for the people that are out there street smoking. But if you're talking about me, and if I've got a cancer, and I've got severe nausea, vomiting, and I'm dying from starvation, and this is something that I could take, inhale, and I would feel better and would be able to eat and gain weight and do better. You know, I'm not worried about addiction if I'm worried about that. And so that's not a good way to look at it. But you know, we're talking about medical marijuana. Now, if you're talking about street marijuana, and you know that, well, you know, to me, I think we do need to do that too. We need to make some real hard decisions about that, because I'm concerned about what's going on, but we aren't even looking